Hi everyone, my name is Sophie and I'm a PhD student at Queen's University Belfast. I am supervised by Dr. Leandro Garcia and Professor Ruth Hunter. And as part of my PhD, we have been developing an agent-based model for collective patterns and income inequalities of leisure time physical activity in adults. Before I start my presentation, I just wanted to highlight that the model isn't finalised, as in we haven't run the simulations yet, but we are in the initialisation process of setting everything up. So any feedback, any comments are really welcome. So just before I talk about the model purpose, I wanted to highlight some background and rationale. So we are interested in the adult population and specifically leisure time physical activity, which is any physical activity individuals do in their free time for recreation. And we're interested specifically in this domain because we know that inequalities in leisure time physical activity are extensively documented. So, for example, individuals with higher level of income more frequently report being active in their leisure time in comparison to individuals with lower income. And despite these inequalities being widely documented, progress on reducing these inequalities are proven to be equally, if not more difficult than increasing overall population levels of physical activity. So with that realization and the minimal progress, we are starting to see that actually we aren't sure of what works for effective interventions for different groups of people across different contexts. So that brings me on to the model purpose, which is to understand how collective patterns and income inequalities in leisure time physical activity are driven by interactions between different mechanisms and conditions across two different types of cities. So breaking this down, firstly, looking at the model design, we are using NetLogo to program the model, and I've highlighted here just some screenshots of the world initialized. So within each city, there are two different types of agents. So these are highlighted here. So as people and as spaces for leisure time physical activity. So people and spaces have a number of different attributes. For example, people have a perceived environment, a perceived personal network, They also have an individual level of income, which is reflected here by the different colours of green. So the darker the colour of green, the higher the level of income. Whereas spaces, for example, have a quality score, and they also have different levels of affordability, which is why some are lighter pink, darker pink, and purple. So I wanted to talk a bit more about the cities themselves. So as you can see, the main difference is that city A is more segregated, and specifically the city is comprised of 4 distinct neighbourhoods, and each neighbourhood has an area level of income ranging from low to high income. And within each neighbourhood, the distribution of people by income, the distribution of spaces, parameter values for spaces, for example, are all different. Whereas in City B, things are a lot less segregated. The city is much more open in terms of more equal distribution. And yeah, that's sort of the main difference. The reason why we decided to have 2 extremes in this way was because we wanted to understand the role of income segregation and how this influenced overall patterns and consequently inequalities that we observe. Another thing to mention is the cities themselves aren't meant to emulate a specific real world place. Instead, they're designed as abstract cities. And this was because we weren't looking to make specific recommendations to any place. Instead, we were looking just to test some interventions and understand how the interactions form the patterns that we observe. So moving on to the model structure, very simply, each week an individual decides whether to engage in leisure time physical activity. This process itself is underpinned by a conceptual model that we developed. So the conceptual model is building on a previously validated model that we've amended for our purpose. But just to break this down, I don't know if you can see here, but so we start with the initial intention. So each week an individual gets an updated intention, and this intention is highlighted and updated with the individual's income level, their past behaviour, so from the previous week, and also the behaviour from their social environment that they observe. And this updated intention and conditional to their perceived environment decides whether they engage in leisure time physical activity for that week. So I appreciate there's a lot of arrows and numbers there, but when we were developing the model, we also developed a table that outlined all our assumptions. I haven't included this full screenshot here because the table is pretty large and dense, but I have highlighted an example of some of the relationships just to show that we broke the relationship down and also linked back to how that fitted within the overall process of the decision making. So that's a very brief overview of the decision-making process. This is the same for all people in the model, and like I said, occurs on a weekly basis. So another aspect of the model is obviously the model scenarios. So we're interested in simulating a series of interventions. Specifically, we are looking at interventions with two different categories. So from a personal category and also environmental category. So for example, a personal intervention could be directly increasing the person's attention, and environmental could be directly increasing the quality of spaces. We have a series of interventions planned and ready to run, and as well as the interventions themselves, we're also looking to understand whether the delivery of the intervention matters as well. So is it more effective to have a more intensive intervention, or is it more effective to have an intervention that is more broad reach in terms of how much of the population it reaches? So that's a summary of the model structure and some of the scenarios we have planned. I just wanted to talk a bit about the development process for the model itself. So we started with a conceptual model, as I highlighted. This was building on a previously validated conceptual model looking at leisure time physical activity in adults, but we built on this model to account for income inequalities. We also did the reviews to substantiate the underlying causal mechanisms of the decision-making process and also how these differed across contexts and for different populations. And then after the reviews, we drafted an intermediate revision of the conceptual model, which we sent to experts to gain their assessment. And we received around 40 assessments from academics in relevant fields, which really helped us to refine the model and also get an understanding of how close we were to replicating the decision-making process from real life. As well as this, we also spent some time specifying parameter values. So specifically using empirical data, for example, to inform the distribution of spaces in different regions and people's preferences for activities, for example. And when we sort of felt comfortable with both of these processes, in that the conceptual model was stabilized and also that we had enough evidence to inform our parameters, we began model initialization literally the beginning of last month. So I just wanted to highlight this process to show how we have gone around developing the model, but also to show the substantial amount of work that we put in even before we decided to even build the model itself and start coding the model. And I guess just to finish, I wanted to highlight some challenges that I have personally noticed throughout developing my ABM. This was the first agent-based model that I've been part of a team developing. And the first thing I think that was quite challenging was defining the right level of detail for the model. So particularly when we were going through the review process and also when we had suggestions from specialists, there were so many useful suggestions, so many other factors, but making sure that we were pragmatic about the parameters that were inside the model boundary and were not inside the model boundary was something that took a bit of time. And especially in terms of, we had to be pragmatic with, for example, accounting for the number of model runs and the level of complexity already in the model itself. And then the second thing was obtaining relevant empirical data to parameterize and collaborate the model. So specifically understanding what kinds of information we needed to help support model decisions and also inform collaboration of the model. And I think the only really thing that helped me here was just always reflecting back on what was the purpose of the model and going through what we wanted to gain out of the model and being really true to that purpose, because there's always other levels of complexity that we could have added in. But I think we've just sort of made a note of those, and then they are some suggestions for future work and things that we can build on the model itself. So that brings me to my last slide. I've included my email address, so if anyone's got any questions or comments, it's there. Thank you very much for listening, and I'm happy to answer any questions now as well.
Great, thanks, Sophie. Excellent, well done. It was really interesting work, actually. Any questions for Sophie? I'm just monitoring the gallery, one sec. Okay. I have a question, so if it's okay. So when you're talking about the environment parameters that go into the model, so can you tell me a bit more about how you arrived at those? Because I think you mentioned in your preamble that it was a quality measure, but then I guess that's a bit black box, isn't it? So what is it about the environment that then interacts with the individual agents that creates change in the system? So can you tell us a bit more how you thought about
that? So we have broken down the individual's environment into obviously social, perceived and physical, and aspects of the physical environment are things like quality, things like distribution, things like types of activity offered. And one assumption that we have in the model is that an individual's area level, for example, of their neighbourhood can influence the available quality. So for example, there's some data that there's spaces, for example, that are in low-income areas tend to have lower quality than, say, in more affluent areas. Also, in terms of the types of activities are offered. So, for example, in low-income situations, things like soccer fields are more common in comparison to gyms and more expensive activities as well in more higher-income environments. These then feed back into the individual's perceived environment. So it's really, they fit together as one, I guess, but even though they're separate functions. But there's also things, for example, like accessibility, safety of the environment as well, that are within the model as well.
Right, thanks. Yeah, I guess I was thinking about kind of cost of activities. So you kind of mentioned gyms versus the playground. So is that something that's a parameter as well that will interact with household income, I'm guessing?
So we have affordability of spaces. So a space can either be free, affordable and expensive, and then based on the individual's income level is whether they can access the space or not, sorry. But yeah, we use empirical data for a rough idea of the distribution of free versus private spaces.
Right, thanks. I got one more quick question, if that's okay. I was kind of interested in your process about refining the conceptual model. So what kind of changed as part of that process, or did it not make much difference? Because I've spoken to a few people over the last kind of couple of years about whether to do an evidence review and use that to build the model, the conceptual model, or actually doing actual formal in-person kind of group model building workshops to develop the model. And I guess I'm not really sure about what's the best or the best option and what you get out of all of those things. I wonder if you could reflect on
that. I think the expert consultation was really valuable in that we asked academics in different fields, for example, inequalities, built and social environment, physical activity promotion, and psychologists, like sports psychologists as well. And being able to draw on the different fields helped shape and I guess refine for example, the terminology, the way that the relationships linked from one aspect to another. But also we included academics from a number of countries, so getting input, because the model isn't specifically to emulate a specific place, getting those ranges of experiences and drawing on that what they know from their own environment was really useful, and that helped shape the decisions as well. I guess it's always difficult, like I mentioned, because there was so many useful suggestions that we agreed, like for example, other indicators of inequalities was suggested, which we completely agree, inequalities do tend to compound and they all have an effect. But because we're only interested in income inequalities, it involved a lot of conversations of refining down and being like, okay, this is useful, let's make a note of these, but for now we need to only focus on these things. So I guess it was useful to gauge where we were in terms of how close we were to replicating real life decision making. And yeah, just being mindful of not trying to take away from the model's initial purpose as well.
Right, thanks, Sophie. There's a quick question in the chat that I think follows up a couple of those points. So, in reflecting on the challenges you've had in model building, how did you achieve a balance between including enough detail to be realistic enough and being able to interpret the model outputs? And then did you prioritize in terms of the stakeholder input or the academic input? So where did you decide, where's the boundary? Where did you decide to stop?
This was something that took a lot of conversations with my supervisors, as you can imagine. But I think the main thing was we prioritized consistent suggestions. So for example, if a parameter was suggested that we hadn't initially put in, this, I went back to the literature specifically looking for evidence on those parameters. In some instances, they were there and they were included in the model. And I guess, like, so if they was most commonly suggested, also in terms of sometimes things were suggested but were relevant to different aspects of physical activity. So again, we're being very specific on only leisure time physical activity. So I think it was all these different things. So looking at the adult population, looking at the domain of physical activity, looking at the types of inequalities, and sort of every single thing that was suggested reflecting back to those was how we sort of refined the model. But like I said, we have made a list of things that we thought were useful as well. And we, future work, I guess.
Yeah, it's just model 1.0, isn't it?
Yeah, one of, yeah.
Great. Thanks very much, Sophie.